Danville has really great trail system. They also have the river walk, which is nice and flat.
They have approximately 26 to 30 miles of trails. So if you're an avid mountain biker, they're excellent, and they're only 5 minutes away from downtown.
Since I've been here in the last 8 years, there's continued growth. The fact that there's a taco and tequila bar, a brewery, a winery. There's a growing community and there's a lot of potential.
And the things that I really love about it is just that the residents all seem to get along. They seem to be truly happy.
When I finished my residency here, I felt like I was taught well. I knew what I was doing. I had every confidence that I would succeed, and it worked out.
Ultimately, I think it's what you want from residency. You can find easy programs or you can find programs that will train you for the future. It was really important to me to have a program that was going to make sure my first day out as an attending would not be a smack in the face of, oh my gosh, this is now what I have to do. I wanted a program that would train me to do the job that I need to do for my future in medicine, and that's exactly what we have here, is a program that prepares you to take that step out, challenges you in areas that it needs to, so that you can successfully be independent.
Residency's hard no matter where you go, but it's very nice to come to a place where you're very supported and cared for, not only by your attendings and your faculty and your administration, but also by the community themselves.
Myself and my 3 partners, we're employed by Duke University to provide cardiology coverage here at this hospital at Sovah Danville. It brings the, all the horsepower of Duke and its academics to the residency. They're going to get exposure to lots of disease, and they're going to be able to manage it hands-on. A nice thing about working at a community hospital as opposed to a big university hospital is you really get to know the patient population, you get to know their families.
The closed ICU is an ICU that is run by intensivists 24/7. The residents get amazing opportunities in the ICU because there is no fellow as a buffer between the resident and the attending.
Once that patient is there in the ICU, they are your patient and you get to manage them. There's a fair amount of autonomy in the intensive care unit.
There's no fellows. There's nobody to challenge you in regards to a procedure or taking care of a patient. It's the residents. The residents are tasked with leading a code. The residents are tasked with leading a rapid. It's that exposure that you need, again, to be functionally independent when you do graduate from residency.
You do have more hands-on experience that way, and you have a better learning opportunity. There's more one-on-one time with the attendings as well as with the senior residents.
Our family medicine program, we are a 666 program, and our internal medicine, we are an 888 program. So we're relatively small programs, and with that, our residents get to spend a lot of time with one another. They develop really close friendships, and you pretty much become a family.
It's like a family, it's a family medicine residency and it's very family friendly.
As we are family medicine, it is a very well-rounded program. We get very good training in our continuity clinic where we see a lot of pathology.
You see cases that you've only read about, and you have attendings who, when they call you into the ER or bring you into their office, are like, this is going to be a once-in-a-lifetime opportunity for you to see this or to be a part of this case.
I really think that this program, in its size, being a small program and a close-knit program, makes it really special.
With the residents, you learn from them too, as an attending. The first glimpse of something that's new sometimes come from them.
Sovah Health has a sincere and embedded culture of patient safety. This is based on a continuous quality improvement process that's utilized throughout the hospital's care system and the hospital's clinics. To that end, residents are members of all the hospital committees that participate in this improvement process. Thus, there are numerous opportunities for clinical research in each of those committees.
If you want to be somewhere where you're going to watch and observe and look over somebody's shoulder, then maybe you want to go to one of the larger academic teaching facilities. But if you want to go somewhere where you actually get to do the work, Sovah Health is the place to come.
I wanted a program where I could be independent, where I could learn those things that would help me be independent when I graduate.
The program is bar none great at training you to be a competent physician treating the bread and butter of medicine, which you're going to see every day. I feel very confident coming out of this program.